Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Okay, welcome back to Smile Sisters.
Hello.
Hello. What are we going to talk about today?
So today I wanted to touch on a subject that I see with patients coming in who've had other consultations for cosmetic dentistry. Is they are often recommended to do like every tooth in their mouth or every tooth that shows in their smile, which is like maybe 10 to 12 on the top, 10 on the bottom. And I'm always talking patients down from that.
Mm-hmm.
So what I want to talk about is less is more. Don't do more teeth if not necessary.
But why? Because it looks so much better.
Well, not necessarily. That's what I'm saying. Maybe that's a necessity. So sometimes people go maybe out of state or out of country and they are given a deal. They're like, let's do all of your teeth and it'll only be this much per tooth. It'll be less expensive really per tooth. And they think they're getting more value out of it.
Right.
But the value is to transform your smile into something that you want. And if you only need to, do veneers on 4 of your teeth to get the smile that you want, then you don't need to be covering up the rest of your teeth, because just because it's available at a discount price doesn't mean it's good for you to do that.
I guess what I'm getting at is that shaving teeth down is never a good thing. It's not something you can just like regrow.
You definitely don't want to shave your teeth down unless
Right.
absolutely necessary.
Right.
And most times it is not necessary.
Right.
It's a very limited situations where we really have to cut teeth down.
Mm-hmm.
Really the only time your teeth should be cut down is if they're cracked and they're going to fracture off, they're infected in that area. Really, those are my 2 criteria.
Right.
If you're cutting your teeth down just to get veneers on them, they are overdoing it.
Right.
Probably.
Right. But that's what I mean. That's what tends to happen is that you go and they're like, if you get 4, it's this much per tooth. If you get 12, it's this much per tooth. So instead of just doing minimal stuff, you end up doing your whole mouth.
Yes. And so there's risk with that because now it's more maintenance. You have more teeth that have veneers or bonding on them that you have to maintain. I mean, as good a job as they might do, these things don't last forever.
Right.
So you constantly have to go back in and do something about it. And once you have those teeth covered up, even if they don't shave your teeth down, you never really go back to having nothing.
Right.
You could, but that just realistically doesn't happen.
Right.
So now you're having to kind of do this
Like keep
again.
touching
and
it up.
Keep like messing with it. Yeah. So I think the biggest thing I want patients to know when they come in, especially, is I'm asking them, what do you want? What is the smile that you're looking to achieve?
Right.
What are your goals? Show me photos. What is it that you would like to change? What does your ideal smile look like? And I'm just trying to get at what is their issue, what is their concern. So if it's just that you chip the edge of your front 2 teeth, but you like the color and shape of all of your other teeth, really you only need to repair maybe the front 2 teeth.
Right. Right. But it's, it's just hard to make it look perfect unless you do a whole bunch of teeth, right?
I don't think that's true at all.
Okay.
Yeah. So that's the whole point of
That's
this.
what that's what we're told. That's what I mean.
Well, I think it might be easier for the doctor because if you do all of your teeth, then color matching isn't a problem. So when you only do 2 or 4 teeth,
Right.
making the color of those veneers or bonding match your existing teeth is difficult. You
Right.
have to really, scrutinize what you're doing. But if you're doing like 10 teeth, and then the other thing is the shape as well. The shape has to kind of flow with your existing dentition.
Right.
It has to kind of match, how the angulations and everything look. So when you go out of state or out of country and they do like 10 or 12 teeth, often they're just sticking in the same prescription for everybody.
So it's all the same color, the same shape,
Yeah.
whatever.
So I mean, they're creating maybe a nice smile, but it's more generic in a way. They're just doing the same smile design and and putting it in.
Yeah.
I shouldn't say everybody does that, but it makes it easier. They don't have to color match and they don't have to shape match, really.
Right.
But is it meeting your goals as to what you wanted to get?
Yeah.
That's the problem.
Well, look, let's get to the actual issue here. The actual issue is cost. That's why people go out of state or out of country and get these procedures done, right? Because it's actually maybe cheaper to like go to Turkey and have like a 1 week vacation and get your veneers done than to just do them here. It might be cheaper.
Oh, it probably is, yeah.
So that's the real issue. But why should they incur that extra cost here in the US, and get less teeth done and not get a vacation to Turkey?
Well, I don't know. So, I mean, because then you don't have the risk of having all this dental work done that may not have been done well, or your teeth have been shaved down. And ultimately, you may not get what you wanted, because often they're not doing a trial smile. They're not showing you what it's going to look like. I had a patient a couple of weeks ago. She came in with fractures on her 2 front teeth. She had had bonding done on her teeth, and she had had 10 uppers and 10 lowers done. And she had done them like 2 weeks prior to coming in here.
Yeah.
And the 2 front teeth had fractured off. And she came in and we, repaired those. And she goes, I don't look like myself anymore.
Right.
I don't like how this looks. And she showed me photos of her smile before, and it was beautiful. Her teeth were a little bit short, and the front 4 teeth were a little chipped. But when they had done this, they'd made her teeth so long.
Right.
And they hadn't done a bad job. Like at the gum lines, they looked nice, whatever. But then made them so long that she fractured them off, first of all. It wasn't a functionally good thing for her because she couldn't maintain it. But they were super, super long. It totally changed the shape of her face. She just didn't look like herself.
Right.
And she was just really unhappy. She was having jaw problems as well because of the way the bite was done. So what we ended up doing, because they were actually nice at the gum line, they were smooth and clean.
Yeah.
We actually ended up just shaving them down like a lot. Like we took
like
a bunch
to make
off
them
the
shorter.
edges. We just made them shorter, and then it suddenly fit into her face. That looks like me again.
Right.
But I have to say that that's not always possible. This. She was very fortunate because they were actually done well. Other than the shape was wrong, it didn't fit her face, and that was part of the issue. And she probably only ever needed to get the front 4 done.
Right.
But then she went over there, and they're like, "Yeah, we do the whole smile,"
like the whole
and
thing.
they did everything.
Yeah.
And then she went through all this pain and discomfort, and then an additional cost to come here for me to shave them down. Now, if they had not been done right on top of that, then she would have had to pay for a redo of a lot of bonding.
Yes.
Versus, initially just getting her chief complaint addressed, which was, oh, my teeth are a little bit chipped, they're a little small.
And this is bonding. Like if they do porcelain veneers, then you really can't. It's not like something you can just adjust.
No, not to the extent that we've done for her. Sometimes you can do a little bit, but with porcelain, often you got to cut the whole thing off and redo it.
And that's like a lot more involved.
So I see that often. Or patients come in, and it's not even out of state, out of country. They'll come in and be like, I went somewhere else and they told me to do 10 and 10. And I look at their teeth and go, well, what are you concerned about?
Right.
And they say, oh, it's just this little thing I don't like.
Right.
Okay, well then let's just address the little thing you don't like instead of, covering all your teeth up with bonding or veneers. And then the third thing is the age of the patient. So I had a 19-year-old in the chair yesterday, and she was like, I want veneers.
Right.
And she had beautiful teeth. They were just crooked.
Right.
So I was like, you know what? We're not going to,
You know what? No.
No. We're going to cut your teeth down.
It's a no.
And do a bunch of porcelain on your teeth that you have beautiful teeth. You just need to align them. And I had to really talk her and be like, don't go somewhere else and let somebody else cut your teeth, okay?
We get that a lot because we are in Los Angeles, so we get a lot of people who are beautiful, young, gorgeous, beautiful, healthy teeth, and they just want to get this crazy veneer slapped on. We have to talk them off the edge sometimes.
I do. I felt a little protective. I'm like, I don't want to see you go somewhere else and get your teeth shaved into little nubs, please.
Please don't.
Do the right thing. So, and unfortunately, it's easy for dentists sometimes to just be like, okay, we're going to cut every tooth into a little nub and then, cover everything up. It's a prescriptionally made sort of design. There isn't a lot of thought and individuality put into it, unfortunately.
Right.
And so, it can be done on the cheap
Yes.
as well.
Yes, it can be done on the cheap because it's like one thing that it's like one size fits all, so it's much
Yes.
easier.
Yeah.
Yeah, I mean, just like with everything else to do with health and, our bodies, it's never one size fits all for
It's not.
anything. Even hairstyle, if you go to a hairdresser who only does one hairstyle, like that's not going to work, And same with teeth, same with everything to do with our bodies. Like it has to work for us.
It has to work. But be careful, hair and nails are very different from your teeth.
Right.
They will grow back.
Yes.
Right?
Yes.
Your teeth, they will not. And they serve a very, very important function in your life.
Right.
Which you need to use at least 3 times a day.
At least.
About when you're
unless you're fasting.
Unless you're fasting.
Well, okay, look, we've talked about this before, but shaving teeth down really weakens them because teeth have layers, right? Like, and each layer is there to serve a purpose.
Yes.
And there's this outer layer that's called enamel that's really hard. It's the hardest substance in our body.
Yes.
And it has no nerve endings, and it's there to protect your teeth. So as a lot of times people feel sensitivity, it's because that enamel has worn away and now you're starting to get sensitive.
Sure.
Now imagine if someone just comes and just literally like shaves that enamel off of your whole jaw.
All around your tooth.
That's what's happening.
Yes.
That's what's happening. And you're left with the inside layer, which is called dentin. That's much softer. It's not there to protect, but it's there. It's got all the nerve endings in it, and that can be very, very sensitive. So unless you cover it right up, you're always going to have sensitivity. You're always going to have issues.
Right.
And you're more prone to cavities because, again, the enamel layer is there to give that protection, and the dentin doesn't have that.
Yeah, as well as it gives structural strength. So the enamel in your tooth also prevents your tooth from bending.
Right.
Right, because it's stiff, whereas the dentin is soft, so it'll flex. So often if you go somewhere and they overcut your teeth, especially for veneers, and they remove all of the enamel on the surface of your teeth, and they put crowns or veneers on your teeth, if there's no enamel left, that tooth can flex, but your porcelain veneer doesn't flex.
Right.
So what happens is when you bite down and you squeeze, your tooth will flex underneath and your veneer will either pop off or fracture.
Right.
And so that's one of the issues. People get work like that done where they over prep your teeth, overcut, remove all the enamel. Now there's no flexural strength in your tooth. Your tooth is way more flexible.
Right.
But the material that's layered on top is not.
So it's like something bending underneath something stiff. So
exactly.
the stiff thing is going to
The
pop
stiff
off.
thing pops off. And so people are coming in with, oh, my veneers keep falling off. What do I do? So now the only other option is to prep the inside of the tooth and form a crown so it has more retention.
Yeah.
So anyways, it leads down this rabbit hole of more and more treatment. And then not to mention, now you might need a root canal because you can also, when that tooth bends, crack your tooth, fracture it, right? It can split. And then now it goes into the nerve, you need a root canal.
Yeah.
Lots of problems.
So like you said, it's not like hair and nails. It doesn't grow back.
Does not. Yeah.
So the less you do to it and the less of your own natural tooth structure that you preserve, the better.
Yes.
And you can get amazing cosmetic results with minimal cutting of your teeth.
Yes.
That's the goal. And that's the goal.
That's the goal. Yeah. And so we always want to address the cause of the problem as well. So if the issue is that the teeth are crooked, they're in the wrong position, you should consider aligning them by moving the teeth instead of just cutting them to make them look straight by layering something straight over angulated teeth.
Right.
Because then you have to cut the teeth a lot in order to layer them with something and make them look straight. So first of all, don't do veneers when the problem is that your teeth are crooked. Do veneers if the teeth are chipped, worn down, have old fillings on them or whatever, stuff like that. Those are reasons to, cover the teeth.
To do veneers. Yeah. And don't do just 12 veneers just because. What are you trying to get? Is it just a couple of front teeth that are chipped, or is it maybe the color? Maybe you can just whiten. Maybe that's all you need. Maybe you don't even need to do any kind of restorative work.
Yeah.
So really figuring out what is it that you're trying to get before you just like shave off all your teeth.
Yeah, and so that's a good question. I always ask patients, like, if I could wave a magic wand and give you your ideal smile,
Right.
what would that look like to you? You
Yeah.
know, really figure out what is it? What is it that makes you uncomfortable about smiling? Because
Right.
that's a big trigger, right? When patients say, you know, I don't feel comfortable smiling, I cover my mouth when I smile, then we know we got to do something about why are you doing that? And then they'll be like, you know, this one is always doing this.
This one
I don't-
sticks out.
or it's dark
Yeah,
here. I don't
yeah,
like,
yeah,
you
yeah.
know? And so maybe that's all we need to address, or maybe it's just like 2 or 4 teeth. The other thing is it's always easier to do 2 or 4 versus 1 or 3.
Yes,
But we do that. Sometimes people come in, they have 1 dark tooth, right?
that's right.
And they're like, I've gone someplace and they told me to do 2 veneers.
2 or 4, yeah.
2 or 4. And it makes sense because it's really hard to shade match one tooth to the other. But again, if your other tooth is exactly how you want it to be, the right
Yes.
color, the right shape, everything's good about it, then you only really need 1. And I always tell my patients, you might be in here a few times because just doing 1 is hard.
Yeah,
Because you have
it
to be
takes
able
a few
to
tries
match.
sometimes, yeah.
Yeah, so it's
But
a
it's
little bit harder.
doable. It's totally doable.
It's doable.
But that's where the extra costs come in, honestly, rather than just like doing 2 or 4. Because then you just do it and it's done. But if you're just trying to do 1 and be really perfect about it, it takes more time. It takes more detailed attention. And so
Yeah.
it costs more. I mean, that's
It is-
it's just
it
the
is more
reality of
expensive,
it. Yeah. Or if we're really trying to minimize the number of teeth that we're like restoring, maybe we have to put in a little bit more time to analyze your smile, to think about it, to do a trial smile. These things have more cost, but in the end, you end up with less restorative work, teeth that are going to last you a lifetime,
And
and
the
less
smile that you want.
sensitivity, less risk of getting, you know, all this like cavities and root canals, and the smile that you actually want rather than like a one size fits all smile.
Yeah. So it's not, you know, comparing prices. And often the first question people ask, you know, on social media, whatever, is what do you charge? What do you charge? But the cost, our fees are not super high, but they're not super low. I think we're
Right.
kind of in the middle. But the reason why something can be more expensive is because we do all of these steps.
That's
because
right.
we're going to do what's best for you, or try to do what's best for you,
Right.
rather than just
Just
fit the
doing
same
the
smile
main
on
thing.
everybody. Yeah. So be careful about that. When it comes to cosmetic dentistry, it's not comparing apples to apples all the time.
No.
So
So, what are the top 3 things that people should think about as far as less is more?
before you go into a consultation, really take a look at yourself in the mirror, you know, smile and decide, what is it that I truly want? What would make me happy? So figure that out. Often people come in and they're like, I don't know, doc, what do you think? You know, and sure, I can give you all kinds of, you know, ideas and suggestions, but I really need to know what it is that you're after first. So
Right.
try to kind of figure that out for yourself. And then when you are pricing stuff out, which you should, really evaluate what you're getting for that fee. you
Right,
know?
right.
Are they doing a smile design? Are they pushing you to do a whole bunch of teeth? Ask why. Like, why should I cover, you know, 12 teeth here?
Right.
What's the necessity? So those questions, you want to be critical of that and evaluate the amount of time you're spending in the chair. If you're just going in, they're prepping the next day, they're sticking them in, and they're sending you off,
Right.
then maybe they're not preparing, doing the smile design, all of those things. So price comparison is good, but only after you realize what you're getting.
So,
out of
know
it.
what you want before you go in, then do your price comparisons.
Yeah. And treat the cause of the problem. So really look at what's wrong and then
Yes.
figure out how to fix that with your provider. But if the issue is like crooked teeth, really consider doing orthodontics rather than veneers.
Right. Unfortunately, like with many other things, there is no quick bullet that will fix everything, right?
Of course not.
We have to take our time, analyze what it is, take our time and really fix the cause problem without damaging the rest of our teeth unnecessarily.
Yes. Take your time.
That's what we want.
Yeah. Do it the right way.
Yeah.
And then hopefully you're just doing it once.
For sure. Well,
Okay.
okay. See you next time.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.